Hello, my name's Jacqueline. I'm going to be performing a physical exam on you. How are you doing today?
Okay.
Good. How do you feel right now?
All right.
All right. So overall, the general survey of the patient is he's clean and well kept, and he seems to be in a good mood. His skin color is appropriate for his ethnicity. And I will first start by inspecting the head and the scalp. I'm going to be looking for any abnormal lesions, any lumps, bumps, or swelling, any possible mites or dandruff that might be, and I'll also be checking for hair distribution, which that all seems to be normal on him. So next I'm going to palpate the scalp. I'm going to just again be checking for any tenderness, swelling, any possible lymph node swelling in the back of the head, and that all feels okay?
Mm-hmm.
Okay. Next I'm going to also palpate the maxillary and the sinuses. So if you don't mind just taking your glasses off for me for a second. And I'm just going to, no pain or tenderness, right?
No.
Okay, great. And I'm going to just check the lymph nodes that are under here on the neck. Okay, and the lymph nodes in the back of the neck. No swelling, and I did not feel any masses or lesions there as well. Next, I will inspect the face. There's no facial droop present, and I will assess for cranial nerves 5 and 7. Can you raise your eyebrows? Can you frown? And can you stick out your tongue? Okay, great. So, and he's able to open his eyes up against resistance, and that will test for cranial nerve 5 and 7. Like I said, they're intact. And now I will test for cranial nerve 5 for sensation. So I'm going to have you just close your eyes, and I'm going to touch your face in 3 different places. Tell me when you feel it, okay?
Mm-hmm. Feel it. Feel it. Feel it.
Okay, so cranial nerve 5 is intact. And I will palpate the masseter and the temporal muscle, checking for any tenderness. So can you just bite down? Okay, and just bite down. Okay, both muscles feel intact and strong. And now we're going to check the eyes. I'm going to check the peripheral vision first, and then I will check the central. So if you will look at my nose and cover one eye, I'm going to hold up a set of fingers, and you're going to tell me how many you see, okay?
2.
Perfect. Now let's cover the other eye.
3. 4.
Perfect. Okay. So now we're going to test your near vision. Can you please cover one of your eyes and read the lowest line that you can for me?
LTFPH.
Okay, so that eye is 20/20. Now we'll switch eyes.
LTFPH.
That eye is also 20/20 with his glasses on. Now we will perform the Hirschberg test. Well, I will stand 2 feet away, shine a light in the patient's eyes, and we'll be looking for reflection of light in the cornea. This is checking for strabismus, and we will be looking for normal pupillary alignment. So, just look forward for me. Okay, great, and it's shining in the same spot in each eye. Okay. Now we will perform the cover-on-cover test where we're looking for lateral movement of the eyes. Okay, I'm just going to cover one eye. Just look forward for me, okay? Just focus on that orange right there. And no lateral movement of the eye. And now we will examine the ocular movements, which test for cranial nerves 3, 4, and 7. So the extraocular movement exam. So you're going to follow this pen for me, okay? And don't move your head, just your eyes. Perfect, that is intact. So cranial nerves 3, 4, and 7 are intact. And while inspecting the eyes, we can see that they're properly aligned, spaced apart, eyelids are intact, they have no lesions, and eyelashes have are evenly distributed on both eyes. And now I'm going to inspect the lacrimal apparatus and the conjunctiva. Do you mind just taking your glasses off just so I can take a better look? Okay, so right now the lacrimal apparatus, they're both intact, they're both pink, no exudate, and I'm just going to check inside just to see the conjunctiva. There's no injection, the sclera is white, and there doesn't seem to be any lesions on the iris or the cornea. So now we will check for perla we're checking that pupils are equal, round, reactive to light, and accommodation. So this is testing for cranial nerve 3. So if you just look forward for me, I'm going to shine the light in your eyes twice in each eye. First time, we were checking for the reflex in the eye. Second time, we were checking for accommodation in both eyes. And he does have perla, so cranial nerve 3 is intact. Now we will perform the fundoscopic exam, which will start with the red reflex test, which will indicate if there is a retinoblastoma possible. We are looking for an orange-red color in the cornea of the eyes. We want this to be symmetric. So if you could just look forward for me, I'll stand about 2 feet away and just shine the light in the eyes. Okay. Okay, so red reflex is intact, and again, we were checking for if there's a possibility for retinoblastoma there. Now we will check the optic disc, which is normally orange and pink in color, so I will be a little bit closer for this. And I will check his left eye with my left eye and his right eye with my right eye. Okay. Okay, so we checked the optic disc, and it is normally orange to pink in color, and his was, and also checking the retinal background, ensuring we do not see any cotton wool spots or hemorrhage, which we did not. And now we will inspect the ears for shape symmetry by palpating the pinna and the tragus. So do you feel any pain or tenderness on either side?
Mm-mm.
Okay, great. I will inspect the ears with the otoscope, looking for the tympanic membrane. We want it to be pearly gray in color. And we're going to assess to make sure that there's no drainage, redness, or swelling inside of the ears. Okay. And the tympanic membrane's pearly gray on that side with no drainage and minimal wax inside of the ears. Also pearly gray, no drainage, no swelling, no bulging of the tympanic membrane. And now we will test for hearing the Weber and the Rhine test. So first we will do the Weber test. So I'm going to hit this tuning fork. We're going to put it on your forehead, and we're checking for that you can feel it equally on both ears. So tell me if you feel it more on one side than the other, okay? And tell me when you stop feeling it.
Feel it on both sides. And
Great.
it stopped.
Okay, great. So, and I have a clock on the wall, which I'm checking for the timing. So now we're going to do the Rhine test, which the Rhine test, I'm going to put it on the bony prominence behind the ear. And we're going to, once you stop feeling that, you're going to let me know. And then we will check for bone conduction versus air conduction. So first we'll check for bone conduction, and you'll tell me when you stop, and then we will put it in front of your ear for air conduction, okay? Tell me when you stop feeling that or hearing it.
Stopped.
Do you hear it now?
Yes.
Okay, and let me know when you stopped.
Stopped.
Okay, and again, I'm timing that with the clock on my wall. And we'll do it on this side. Tell me when you stop feeling it or hearing it.
Stopped.
And how about now?
Still here. And stopped.
Okay, great. So he passed both the Weber and the Rhine test, which again checks for air and bone conduction. That's the Rhine test. And now I'll perform the whisper test. I'm going to cover one of your ears, and you're just going to repeat after me. 1, 2, 3.
1, 2, 3.
4, 5, 6.
4, 5, 6.
Perfect. Okay. And that concludes our inspection of the ears. So now we're going to move on to the nose. We're going to inspect for shape and symmetry and palpate the bridge of the soft nose. So if you don't mind just taking your glasses off again. So do you have any tenderness there?
No.
Okay, great. And the nose looks equal. Just looking from the outside, septum is intact from the outside. Now we will inspect the inside of the nose. So we're looking to see if the turbines are pink and that there's no grayness or bogginess inside the nose, and we're also going to be checking for discharge. grayness or bagginess can indicate something like allergic rhinitis. If you could just tilt your head up for me, and the drainage could also indicate maybe a possible infection. So sinus is intact, and turbines are both pink, and there's no drainage or swelling, and you don't have any issues, and you could feel like you could breathe in just fine.
Mm-hmm.
So now we are going to test for the sense of smell for cranial nerve 1. Can you just tell me what you smell here?
Coffee?
Yes, great. So cranial nerve 1 is intact. And we already did it, palpate the sinuses in the beginning of the exam. So now we're going to inspect the mouth and throat. We're going to inspect for symmetry of the skin, and we're going to inspect the buccal mucosa. So here, if you just want to open up for me, I'm just going to take a peek inside of the buccal mucosa. Okay, and I'm looking for any lesions, bleeding, swelling, and I'm making sure all the teeth are intact, which they are. Say ah, stick out. Okay, uvula is midline, tonsils are intact in there, no tonsil stones. Can you press up against the tongue depressor? All right, we're checking for strength of the tongue. Great. And we will also now check for gag reflex. All right, gag reflex is intact. So that shows us that cranial nerve 9 and 10 are intact, and for the tongue, that shows us that cranial nerve 12 is intact for the movement and the strength of the tongue. And we also inspected the hard and the soft palate. If you could just again look up for me and just stick your tongue out, stick it up. Right, hard and soft palate both intact, no lesions, no bleeding, no swelling there. And now we will check we could check for taste if we wanted to, which that is cranial nerve 7 and 9, and I would give him something that's either sour or sweet and assess for taste. And now I will palpate the lymph nodes on the neck, which I already did, but I will do it again. And if you could just put your chin up a little bit, right under the cartilage, I'm going to check for the thyroid. Palpate, make sure that there's no goiter, swelling, or nodules that I could feel, and I can't feel any. Can you just swallow for me now? Okay. And while I'm here, I'm going to also check the carotid pulses. +2, +2, and no thrill on either side. And you have no tenderness in your neck, right?
Nope.
And can you just lift it up and down for me? Shake yes and shake no. Okay, so that means that his range of motion is intact, and his thyroid is also feels fine. So now I'm going to auscultate the thyroid and the carotid arteries. I'm listening for a bruit in either of them. No bruit. No bruit. No bruit. Okay, and now I'm going to inspect the posterior chest first, which I will check for lung expansion. So if you could just take a deep breath, I'm just putting my hands on either side, making sure that it's equal on both sides when I feel it. And I'm going to check for some tactile fermentus. Can you just repeat after me? Say 1, 2, 3, 4.
1, 2, 3, 4.
And I feel it over there, and do it again.
1, 2, 3, 4.
Perfect. Okay, and now I'm going to percuss. We're looking for resonance. That is normal, so. Okay, and his lungs are resonant in all areas. And now we will check for diaphragmatic excursion. So I'm going to have you take in a deep breath and then let it out and hold it. Okay. And I'm percussing there for the diaphragm, and I'm looking for dullness. Okay, and now I can listen to the posterior chest. All right, just take a deep breath for me. And just continue breathing in and out for me so I can just hear all your lung sounds. And we're listening for any wheezing, rales, stridor, any abnormal sounds that could be potentially there. But right now, all his sounds are clear. Bilaterally, he has vesicular sounds throughout the lung fields. And now I'll inspect the anterior chest for shape and symmetry, which again, same thing. If you could just breathe in for me. And lungs expand equally on both sides. And his respiratory rate and pattern. So he has no labored breathing, no use of accessory muscles, and he is breathing out just normally. His respiratory rate is 18. And now I'm going to auscultate the lung fields on this side as well. Okay, just take normal breaths for me. Okay, and the lung fields anteriorly also have vesicular sounds throughout, so they are clear bilaterally. And now I'm going to auscultate the heart sounds. So we are looking for the aortic, pulmonic, Erb's point, tricuspid, and the mitral. So the aortic is in the second intercostal space, right sternal border. So we will feel for the second intercostal space. S1, S2 are present. And then I will move to the pulmonic, which is in the second intercostal space, left sternal border. S1, S2 is present. We're checking for any murmurs, any abnormal heart sounds, any S3, S4 sounds. Next, we will be in Erb's point, which is in the third intercostal space, left sternal border. This is the best place to listen for murmurs. And also, while we're listening for any tachycardia, any bradycardia, and right now his sounds like it is in normal rhythm. So now we're going to listen for the tricuspid, which is in the fourth intercostal space, left sternal border. And here you can also listen for any clicks of the valves opening or closing. And now we'll listen to the mitral, which is in the fifth intercostal space, mid-clavicular line, which is also the PMI for the heart. Okay, and he has S1, S2, no abnormal sounds were noted. Now we're going to assess for some JVD. We would have him sit back on a 45-degree angle, and we're going to check for the jugular veins and make sure that there's no protrusion of them and that they're not coming out in any way. This could be something that's indicative in someone with heart failure and that they're in distress. He has no JVD noted. And now we are going to inspect and auscultate the aortic, renal, and iliac and femoral arteries. So the aorta can be heard up here, as we said before, but it also can be palpated down here in the abdomen. The renal is right to the side of the umbilicus. Iliac is just above the iliac crest. And then the femoral, we can feel bilaterally here. And then while I'm here, I will also inspect the rest of the pulses that we can check, which is the brachial pulses, radial pulses, popliteal pulses, dorsalis pedis, and posterior tibial. And all the pulses are +2, and I do not feel any thrill. And now I'm just gonna auscultate those sounds and of the aortic, renal, iliac, and femoral arteries. And all sounds were auscultated for and noted. And everything came back within normal limits. And now that concludes our assessment right now. Do you have any questions?
Nope.
Great, thank you.